Good evening, everyone. It's Dr. McCoy. It's time for our Thursday evening gathering. It's 7 p.m. Eastern Standard Time. And I'm certainly glad that you are joining me on this evening. We do have a conference call line, and so there are those I want to welcome there. And if you are watching this after 7 o'clock on Thursday, welcome. I'm so glad you're here. You may also be joining via YouTube. I do have a YouTube channel, so welcome to those who are joining through our YouTube channel. I want to talk on this evening about men's health. I've mentioned to us that June is Men's Health Awareness Month, and so it's important that we are cognizant of the fact that men deal with various health and other types of concerns, and we need to bring those to the forefront. So then this gathering on this evening is for men and for those who love them. I also want to include young men, boys, and teenagers, adolescents as well. So I'm going to talk about a few things that have to do with males, if you will, but especially just men's health facts. I really want to look at that. I want to read a couple of things to you. I have a few books here. But I just want to throw some things out here because there is a crisis in men's health because of several things. When we think about men's health, the crisis is because of poor health habits. Sometimes it has to do with lack of health insurance. It depends on their socioeconomic position. Sometimes it's failure to seek medical attention. Sometimes crisis in men's health has to do with dangerous occupations. It could do with the jobs that men have. And so men really live sicker and die younger than women. So that's why it's so important to think about June as Men's Health Awareness Month, but really to think about men's health throughout the year. So men actually die at a higher rate. So not only do they die many times younger than women, but they die at a higher rate because of certain causes of death. And really causes of death, like they die at higher rates when we think about deaths from cancer, when we think about deaths from diabetes, when we think about deaths from suicide and accidents and diseases as well, when thinking about kidney disease, heart disease, and liver disease. So it's important that you are aware, if you are a man, of what needs to happen concerning your health. And it's important for those of us who have men in our lives that we care about. And I think that's everybody, right? That we are aware so that they can live longer and be healthier. So we want men to really take control of their health by getting, first of all, that yearly checkup. Now, I can tell you that this is important to me because just today, now I decided on doing this even last week or the week before when I mentioned it, and a man actually commented in the comment section and asked me to please do it. So I was going to do it anyway, but then guess what? On today, a member of my family who is male, I just learned that he has been diagnosed with breast cancer. So I'm going to mention that a little more, but I think it's really interesting that sometimes we talk about these things because we know a man who has dealt with certain things, and then sometimes God simply lays it on our hearts. Well, I'm grateful that God laid it on my heart, and that there's a man who was watching our gathering a couple weeks ago and co-signed on me doing this. But now I ask that you pray because I actually have a man in my family who has been diagnosed with breast cancer. Some people don't even know, right, that men can have breast cancer. And so now he's talking about how he's going to raise more awareness. So again, thank you for being with me on this evening, because I was already concerned about the talk that we do concerning men. We don't always do that. You turn on anything and it's about women, right? But we don't always talk about men and how much we care for them. But I'm especially grateful to God now, especially because it's hit home in more ways than one. So men, I've never been a man a day in my life. But again, I'm grateful for the gentleman who co-signed on me doing this. And I'm grateful for the information that's out there. You don't have to be a man. You don't have to be a medical doctor, but you should be resourceful. So get that checkup from your healthcare provider. And that's the best way to avoid health problems that afflict men. And those health problems include things like, you can prevent. So I talked about certain health problems, but now I'm really talking more about how you can prevent, how you can perform self-examinations. I know when it comes to women, they talk about us with our self-examining our breasts. Well, with men, that you can do the same thing, and regular physician visits, as I mentioned. So regular screenings, believe it or not, can really catch many health problems in the early stage. And my family member, because he had that screening, it's caught it in an early stage. And so they believe that it has not spread, right? And so we can believe in God and we can believe that God is a healer. At the same time, we should believe that we are accountable for taking care of our bodies. Why do I say that? The Bible, 1 Corinthians chapter 6, verses 19 and 20. The New International Version says, so now I'm talking about accountability, okay? What? Know ye not that your body is the temple of the Holy Ghost, which is in you, which ye have of God, and ye are not your own? For ye are bought with a price. Therefore glorify God in your body and in your spirit, which are God's. So your body belongs to God in the first place. And I would imagine, men, if you love God, then you would then love your body. So as I'm talking about these things, if you are a believer, I just wanted to connect scripture with it. So if there's a man who's saying, well, I don't have time to go to my physician, or, I don't need to do that. And then a man may be saying, I don't have the resources to do that. Well, God loves you. You love God. You can love your body. So let's say, for example, you don't have the resources. Well, what you could do is you could look for health fairs. You could look for free clinics. You could ask your employer about opportunities when it comes to health, because some employers want you to stay healthy because they want you to come to work every day. So think about asking your employer. Fraternal organizations. I'm part of a sorority called Zeta Phi Beta Sorority Incorporated. Well, there's the male side of that, right? We females have sororities, you have fraternities. So then if you don't have the resources, you can ask your fraternal organizations. You can ask your place of worship. Sometimes there are screenings that churches or mosques or temples, they actually take part in. You can ask them for some type of event, or really there are screening events sometimes in your area. So like I say, it's okay to not know, but it's not okay to not want to know. So you can get online and start typing and find out where some things are, especially when thinking about the month of June. So I know we're ending June. I know we're nearing the end of June, but there are always events, every June, so for that man out there, maybe you didn't go to the doctor, or you're thinking, I'm not going this year, or I'm just not going. Okay. At least make a vow that you will, by June 2024, practice some of the things that I'm going to talk about. Okay. And I'm so glad that this is recorded, because you can come back even a year from now, in June, at the beginning of June, and consider some of the things I hope that I'm saying. So, again, 3 ways to take control of your health is prevention, self-examination, and regular physician visits. So then what type of health concerns? I mentioned, concerns for men's health. I mentioned my family member and how he's dealing with this breast cancer now. But there are so many, things that a man can ask their healthcare provider about to get more information anyway. Of course, if you are a believer, we're not talking about, speaking anything on you, that you're going to get cancer, you're going to get, these things that I'm about to talk about are simply, my suggestions so that you might ask your healthcare provider more information. Okay. So if you don't know where to start, I simply want to give you these these health concerns. There's 12 of them. And if you are a woman who has a man in your life, they may be your son, your uncle, your brother, your husband, whoever, you can, jot these down to consider. First thing, well, I'll put the first two together: prostate cancer and prostate health. Prostate cancer and prostate health. I read that approximately 30,000 men die of prostate cancer each year. I know when I was growing up, one of the pastors that, that knew me, I knew him well, he died of prostate cancer. But 30,000 men, all men should consider a baseline PSA. Now, PSA is prostate specific antigen. That's a blood test. They should consider baseline PSA blood test at the age of 40. So if you are a man and you are 40 years old, it's time for you to get that test, okay? And men with a family history of prostate cancer, and especially African Americans and even veterans. Veterans exposed to Agent Orange are at risk. That's important to know. So see why you need to go, every year to get your checkup. And so those men who have dealt with, who are African American or who have a history of prostate cancer in their family, or who have been exposed, those veterans, they should consider getting screened each year, beginning at the age of 40, like I said, age 50 for all other men. So if you don't fall in those other categories, you still should do it. And again, I'm talking to females as well. I'm talking to humans. If you're hearing me, then please, please, please nudge men. And if you're a man, nudge yourself when it comes to asking your healthcare provider more information about prostate cancer and prostate health, okay? So get those blood tests done, and, it's just a quick physical exam, all right? So that's the first two. I have 12. The next one, number 3, is erectile dysfunction. We see commercials all the time, right? ED, erectile dysfunction. Understand. Now, listen to this now. Erectile dysfunction. Failure to achieve and maintain an erection, guess what, can be caused by heart disease. It can also be caused by diabetes. It can be caused by certain medications, lifestyle, and other problems. So a man dealing with erectile dysfunction should not just think about it from a sexual standpoint. Hear that? They should think about it from the standpoint of, what is that caused by? Because it could be caused by something greater than just you want to perform some type of sexual activity. That's important. And so I'm talking about these things because, some people are embarrassed to talk about these things. I don't know, if you've ever heard about this in the church or if you've heard about this in the schools, but somebody needs to say something, because I know that in the Black community that our Black men are dying because these type of conversations are not happening. You don't want to say erectile dysfunction, and so somebody dies. You see that? So again, failure to achieve and maintain an erection can be caused by heart disease, diabetes, certain medications, lifestyles, or other problems. So you need to contact your healthcare provider to get more information. So that's number 3. Number 4, cardiovascular disease. Cardiovascular disease. Heart disease and stroke are often associated with high cholesterol. See these associations here? And also associated with high blood pressure. So both of those things can be controlled. So I read 1 Corinthians chapter 6, verses 19 to 20 to kind of get us thinking about the accountability factor, where God is a healer and our bodies belong to God. So we ought to be good stewards of our body. So there's some things that we can do. So when thinking about cardiovascular disease, high cholesterol and high blood pressure can usually be controlled with us doing some things. Men, I'm saying us as if I'm a man, but women need to do it too, because women die of heart disease. So what can you do? It can be controlled with diet and exercise. It can be controlled with sometimes medication, combined medication. And so I've talked about the importance of medication even during Mental Health Awareness Month. There are some people who say, they don't want to take meds because, God can heal it, Well, absolutely. And God can heal it through medication. So even in Mental Health Awareness Month, I talked about the importance of considering medications. And so now I'm saying to the men, there could be combined medication available for you to control heart disease or control high cholesterol and high blood pressure is what I mean. I see you, Brother Timothy, saying, please, brothers, get checked out on a regular basis. Dr. McCoy, thank you for doing this. My late granddad taught me years ago. Oh, man, come on, Facebook. You won't let me read it all. Okay. I'll read the rest of it later, but you're welcome. You're welcome. And thank you for encouraging, men to go get checked. And, that's why, I want to encourage everyone. If the Lord puts a topic on your heart to talk about, you don't have to necessarily be a professional. You don't have to be clinical. You do need to tell people that, just to be, transparent. But you can be, resourceful, and you can be bold. And when people maybe start saying, well, who are you to talk about that? Like, let's say, for example, you all are not saying this, but let's just say right now someone was like, well, Dr. McCoy, you're a doctor, but you're not a medical doctor. You're a PhD. You're absolutely right. Dr. McCoy, you may know something, but you've never been a man. You're absolutely right. When people start talking about those qualifiers, just remind people that somebody needs to say something. And if I'm not seeing somebody saying something and God lays it on my heart to, I'm going to do it. You don't have to like me or approve me doing it, but I'm going to do it because I know how to read. I can go look up the doctors, And let me say this. My brothers and sisters, I had a wonderful OBGYN. Now, we know what an OBGYN is, right? I had a wonderful OBGYN. Guess what? He was a man, which means that he never had breasts, female breasts. He never had a vagina, but he's delivered more babies. He's been delivering babies since before I was born. So what I'm saying is nobody can tell me that wonderful doctor was not qualified to do what he was doing. And if you, woman, don't want to deliver babies, then let the men do it, right? So my point is, I want to encourage you to do what God lays on your heart. And you may face opposition, but somebody has to do it, okay? So you're welcome, Brother Timothy. I care about all people in all ways. And so I'm going to talk about all things, if I can, because I'm not afraid. There are certain words I'm not afraid to say. I think that even in our faith communities, we got to get more comfortable with saying things like vagina and penis and breast. It's okay. You don't have to teach your kids, pee-pee, and pocketbook, I think is what my great-grandmother used to call it. I was like, pocketbook. These are words that, your doctors, your kids are going to hear these words. So it's better just to teach them the right way than some of those vulgar words. What about those? Now, those are the ones they don't need to be learning, but they should learn, anatomically, to say these things. So it's okay. All right. So let's keep going. Thank you, Brother Timothy. I appreciate you. And I will read the rest of your comment and I'll respond, okay? So then that was number 4. So number 5, testicular cancer. Testicular cancer is another health concern that men should ask their healthcare provider about to get more information about. Testicular cancer is the most common form of cancer in men from the age of 20 to 35, but it can occur anytime after age 15. That's why I said the things that I'm talking about, it's for grown men, but let's also consider our boys, because we consider a 15-year-old to be a boy. Well, guess what? That boy could get testicular cancer. Okay. So we need more information about that one. Now, that one is close to my heart as well, because when I was a hospital chaplain, I had the opportunity to serve. One of my units was the oncology unit. And so that means that I had so many patients with so many different types of cancer. And one of my patients was a young man, a young boy who had testicular cancer. And when I walked into that room and I looked into his eyes, I was like, whoa, I need to educate myself, further, because, I'm so accustomed to hearing about breast cancer, and lung cancer, things like that, which is okay, that's good. But this testicular cancer, men, go and find out more about that. That's why you need to go get checked out. So that's number 5. Then diabetes. We may hear a lot about diabetes, right? Diabetes, you may have diabetes and really not even know it. I know that I had one person where they were just really thirsty all the time, and they went and got screened, and it was diabetes. They didn't even know that they had diabetes. It's not usual for diabetes to go undetected really for years. Okay. I see you saying it is painful. Oh, you're sharing. Okay. I thank you all for sharing. Like I said before, I hope this is a safe space. Now, this is on social media, so that means that whatever you type, people are going to see it. Okay, so I want you to be sure that you're careful with what you share. But at the same time, if you are an advocate, if you're a person with no fear, you got faith over fear and you want to share, then always know that this is a space to do that, because you may teach us something. You may be living with something that we are not. I'll say I am not real versed on it. Okay. Oh, you're saying, is it painful? Oh, that's what you're asking me. Is it painful? You know what? When I met with that young man, we never talked about the pain part of it, physical pain. I don't know if that's what you're asking me. I can tell you that there was an emotional pain because all of his hair was gone, and he didn't like that. He was young. He didn't want to walk around like with a bald head. I hope I'm answering your question. I know that there was some emotional pain and some psychological pain. And you're saying, or how would you know if you have it? Well, you need to go get screened. Yes. Okay. Yes. Thank you for your questions. You need to go. And that's what I'm talking about now, is asking your healthcare provider for more information about it and how you can be screened. That's why your yearly physical, you're welcome. You can take a list like what I'm talking about now into your healthcare provider, and you can know that this is not you being paranoid. This is you being proactive. See that? So yes, that's how you would know. Just go and, make sure you get those screenings. And I'm giving you ages. So if you are, for example, I mentioned the age 40. I mentioned the age 15. I mentioned different ages. So if you are of a particular age, then you should have already done it by now, or it's time to get on it. Okay? So those are good questions. You said, I'm scared. Oh, look at that. I'm so glad that you're being transparent. You're scared. You know what? Some of these things can make you pretty scared. But I think I would rather be scared on the front end than the back end. I think I'd rather be scared to go ask and then find out maybe I don't have it than the kind of scared to be told if you would have come 5 years ago, the cancer would not have spread. You see what I'm saying? So your fear, I appreciate you. Well, God bless you. I appreciate you too. So your fear, let's just kind of think about that. Again, you can either be afraid on the front end or you can be afraid on the back end. Okay. But fear is just something we have to live with in this life, isn't it? Even though the Lord said, I have not given you a spirit. God has not given us a spirit of fear. I get that. And you're human. But again, I just suggest that you reach really low, reach down in there and pull out that boldness for the sake of your health. All right. You can do it. You can do it. So diabetes, men with diabetes are more likely to suffer from heart disease, stroke, kidney disease, and vision problems. So you really want to check out that diabetes thing. And so some of what I'm talking about can be pretty scary, but I want you to be healthy. And I want you not to just have quantity in life where you live a long life. I want you to have good quality of life. See that? Because I wouldn't imagine anybody. I remember my grandmother saying, I want to be able to wash my own body. I want to be able to take my own self to the bathroom. She said, if that changes, I don't know how much longer I want to be here. She said, she was saying to me, really in essence, I want quality in life, not just quantity. And she lived into her 80s and she was able to do all those things for herself until her last day. So, the more we check on these things, the better quality of life that we may have. So then number 7, I said I have 12, is skin cancer. Anyone who spends a lot of time in the sun is at risk of skin cancer. Now, in my ignorance, I used to think we're black people, we don't have to worry about that because, especially if you're black like me. See that with that, with that dark skin. I was like, oh, shoot, my skin is already protecting me from the sun. And for a matter of fact, the sun loves my skin. Okay, ignorant one. If you are in the sun, okay, skin is skin, okay? I know that America created race, but remember now, race is a social construct. Race is not, it's an illusion. Skin is skin and people are people. So race is an illusion. Remember that. It's a social construct. So don't let the enemy fool you to thinking that skin is not skin. So men, skin cancer, anyone who spends a considerable amount in the sun is at risk of skin cancer. Other factors include things like family history. Okay, it doesn't matter that you're black or a person of color. Family history, thinking about skin cancer, repeated X-ray exposure, and exposure to some chemical compounds such as radon and arsenic. Didn't know that, so I'm just letting you know, okay? Radon and arsenic. So then let's move on to number 8. And if you're just joining, welcome. So glad you're here. I'm just talking about 12 important health concerns. Really trying to nudge men to ask their healthcare provider for more information about the following things that that I've been talking about, because it's just so important. And I mentioned earlier that just today I found out that a member of my family, a man, that he has breast cancer. And so I just want you all to be aware that it can happen to you. I'm not saying it will happen to you. I'm saying it can happen to you because we are living in these bodies. And they do perish. But I don't know about you. I want mine to, do it slowly. So that's what we're talking about. So number 8, low testosterone. Low testosterone. As you age, men, your testosterone decreases. This can cause, listen to this, andropause. So we hear about women all the time, right? I know I do, maybe because I'm a woman and I'm listening. But anyway, we hear about menopause in women. Well, now I'm talking about andropause in men. Andropause. Yeah, andropause. Andropause. So when it comes to testosterone levels decreasing, men, that can cause andropause in you. It's a condition similar to menopause in women. And I've heard women talk about it because I hadn't dealt with it, but I guess I'm not of age yet. I don't know, but I think it can happen pretty early in women. I need to read more about my own stuff. See that? But, it's like menopause in women, and it may lead to erectile dysfunction. Now, I talked about erectile dysfunction earlier. If you missed that, please come back and watch this over again, because I talked about ED and how it's important to talk about that. I see you, Brother Timothy, saying, yes, we perish for lack of knowledge. That's right. And we can't be feeling weird about talking about things. We're adults now, right? Okay, maybe we were kids, but we're grown up now, okay? So we can deal with this. But erectile dysfunction, it may lead to erectile dysfunction, fragile bones, depression, fatigue, and other problems. So be considerate when thinking about low testosterone. Number 9, colorectal cancer. Colorectal cancer. Cancer of the colon. Now that one I was really familiar with when I was on my oncology unit. Cancer of the colon and rectum can usually be treated if it's caught early. That's why I was encouraging our brother to go and get checked. Even if you're afraid, take that fear in there with you, coupled with your faith. Take both of them with you, okay? They're going with you. It can be treated if it's caught early. These cancers may be caused by diets high in fat and low in fiber. So we really have to consider that. Some people use things like Metamucil or Benefiber, or they eat certain types of cereals that help them to get things flowing. And you know what I mean by that. You need to have those regular bowel movements. But that's another important concern. I see you, Brother Coleman. People say what you don't know will not hurt you. Not true. What you know early could save your life. All right. Yes. Thank you for telling us that. All right. Thank you. And then lastly, I'm saving this one till last, is depression. Depression. Many of us probably already know that men are less likely than women to seek help for depression. And men, I read this, are 4 times as likely to complete suicide. If you are feeling down and out, men, please hear me. If you're feeling down and out, if you're feeling hopeless, if you're feeling sad for an extended period of time, I'm not talking about what people may describe as like a bad day, like I had a bad day. No, depression is so much more than that, okay? If you're feeling that for an extended period of time, you may be suffering from depression. Help can take the form of medication, which I talked about in Mental Health Awareness Month in May. Medication, counseling, or a combination of both. And being a person of faith, going to church and Bible studies and those things as well. So we add that. But there are other diseases and conditions. I just wanted to share those 10. But I talked about how breast cancer can afflict men, how I just found out about that with my family member today. I also want to mention STDs. And now in 2023, we may be saying STIs. But STDs, prevention is the key to avoiding sexual transmitted disease. You can practice safe sex. And then I also want to mention facial hair. When thinking about men. So I talked about, I did say I had 12. So, I need to go back and say the other 2. But I also want to mention facial hair. So I'll end with that. But number 10 was depression. Number 11 is lung cancer. And number 12 is osteoporosis. So I didn't even finish the thing, did I? So when I think about lung cancer, that was another familiar cancer on my oncology unit. Lung cancer is the #1 cancer killer of men. Did you know that? Lung cancer is the #1 cancer killer of men, but it can almost be totally prevented, though, men, if you make lifestyle changes and if you take certain precautions. So risk factors to lung cancer include smoking and exposure to asbestos and radon. And then when thinking about number 12, osteoporosis, that one is really important because that's the loss of bone density. And it's usually thought of as a woman's disease. My great-grandmother dealt with that. But men deal with that as well. And so that is a recognized now man problem as well, not just a woman problem. So I wanted to mention that as number 12 because if it's left untreated, it can lead to men having broken bones. If it's left untreated, it can lead to permanent disability and even death. So let me go through the 12 that I mentioned, okay? The first 2 I talked about, was prostate cancer and prostate health. Number 3 was erectile dysfunction. Number 4 was cardiovascular disease. Number 5 was testicular cancer. Number 6 was diabetes. Number 7, skin cancer. And number 8, low testosterone. Number 9, colorectal cancer. Number 10, depression. And then the 2 I almost forgot, lung cancer and osteoporosis. So those are the 12 that I mentioned. And then I talked about other diseases. I just added like 3 more things. I mentioned breast cancer. I mentioned STDs. And then I wanted to talk a little bit about facial hair. Now, if anybody knows a beard on a black man, it grows like the hair grows curved, right? And so after shaving, especially with close shaving, the hair may grow back into the skin, and that results in bumps. Have you maybe heard a black man talk about that? It results in those bumps, and they don't like it. I have a brother, and they don't like those bumps, right? And those bumps can be on their face, it could be on their neck, and some men find that using an electric razor or not shaving against the grain helps. So those men who suffer from this problem should see a dermatologist for advice. So I just wanted to throw that in there too. So I said 12, but I more so had like 12, 13, 14, 15. See, I used my fingers. I really had like more like 15. But I hope that this has been helpful as we consider men's health. I just want to encourage the men out there to, be sure that you reduce your weight. And I'm not talking about aesthetics. I'm not talking about for a look. I'm talking about for your health. Reduce your weight, make sure that you exercise, that you try your best to eat right. If you're smoking, try your best to quit smoking. When it comes to caffeine, when it comes to alcohol, watch your intake on that. When it comes to managing your high blood pressure, be careful about that. Reduce cholesterol and consuming negative things. Those I say eating dirty. That's what I call it. Try not to eat too dirty. Be sure that you stay active. Be sure that you have your regular eye tests. That's important too. I would have talked a little more about cataracts and things like that, but for the sake of time, I'm just going to say, be sure that you have regular eye tests, men. Be sure that you improve safety around your home. Things like that. Some men live alone. If you fall and you can't get up, then what? Discuss medications with your doctors to reduce even fall risks. There's something called, what is it? I'm trying to think of it. When people can't get their vertigo. That's it. Vertigo. Look up vertigo. Be sure that you take care of your feet. If you're a man and you've been in the military, they taught you that. Make sure you take care of your feet. There are so many other things that I could say. But again, I've never been a man one day in my life, but I do care about all of the men that I know. I care about the men that I don't know. And I just encourage you to consider, again, 1 Corinthians chapter 6, verses 19 and 20. What? Know ye not that your body is the temple of the Holy Ghost, which is in you, which ye have of God, and ye are not your own? For ye are bought with a price. Therefore glorify God in your body and in your spirit, which are his, which are God's. So please remember, men, this is the end of Men's Health Awareness Month, but it can be the beginning of you being aware that your body belongs to the Lord and it matters. You matter and we need you around. So blessings to you. Take care of yourself. And have you made that doctor's appointment yet? Go ahead. Go right now. Oh, it might be the evening time where you are. But tomorrow, go ahead and make that appointment, okay? All right. Blessings to you. Have a good evening.